Hello everyone, welcome back to Learn with Danya. Today we will be watching about HCC related interview questions for experienced coders. So in this we will be discussing nearly 20 questions I have given with answers. So you can go through those questions and understand how the question patterns will be and how you can answer those questions. So let's get into the video. Welcome to Learn with Danya. In this video, we'll be talking about the most important HCC related interview questions for medical coders and how to prepare those questions. So make a note of all the questions and write down the answers and keep so that it will be really helpful for you while preparing for your interviews. First question. What is HCC? HCC stands for Hierarchical Condition Category. It's a risk adjustment coding system used mainly by insurance companies like Medicare and commercial payers to predict future healthcare costs based on patient chronic and severe medical condition. In simple term, HCC link a patient diagnosis to how sick or costly they are expected to be. So the severe or chronic condition, higher will be the ranking. So why is HCC coding important? HCC coding is important in healthcare and insurance system because it directly affects patients' care quality, provider payment and data accuracy. Simple breakdown. First one is ensure accurate reimbursement. Insurance companies like Medicare Advantage plans pay providers based on how sick the patient is. Second comes represents patient severity. It helps to show how serious or chronic a patient's condition is. This data is used for better treatment planning and disease management. Third comes support risk adjustment. HCC coding adjusts for patient risk when comparing hospital, doctors or health plans. Fourth comes improves quality reporting. Accurate HCC coding ensures patient data is corrected for audits, government reporting and quality measures. Fifth comes reduce audit and compliance risk. Proper coding helps to avoid overcoding or undercoding, protecting organization from penalties or revenue loss. In short, HCC ensures accurate documentation, fair payment and better healthcare outcomes. Third question, what is risk adjustment factor, that is RAF score? The risk adjustment factors RAF score is a numerical value that shows how sick or complex a patient health condition is. It is calculated using the patient's demographic, age, gender, disability, etc. and their diagnosis code ICD-10 linking to the HCC category. Example, a healthy patient with no chronic illness, RAF score is around 0.3 to 0.5. A patient with diabetes, CHF and COPD, RAF score would be 1.5 or higher. This means the second patient is at higher health risk and will require more medical care and cost. So their healthcare providers get more payment to cover that care. RAF means that measures patient's health status. And fourth question, what documentation is required for HCC capture? For a diagnosis to be captured and counted for HCC coding, it must be properly documented by the provider. First, meet criteria: monitored, evaluated, assessed and treated. So monitored means the patient condition should be monitored, and evaluate means the test result, assessed means based on the severity, and treated is the treatment. Second comes face-to-face provider encounter. The documentation must come from a valid encounter between the provider and the patient. Telehealth visits can count if properly billed and documented. Current year documentation. HCC diagnosis reset each calendar year. They must be re-documented every year to count risk adjustment. Provider signature and credential. It is very must. Next comes specificity of diagnosis. The diagnosis must be specific and coded to the highest level. For example, type 2 diabetes with neuropathy instead of just diabetes. In short, for HCC capture, documentation must clearly shows meet and come from a face-to-face encounter and describe the specific condition for the current year. Fifth question, what are the three key elements of a valid diagnosis in HCC coding? The three elements are, first comes meet criteria, that is the provided documentation must show that the condition was managed, monitored, evaluated, assessed or treated during the encounter. Example, hypertension stable and losartan meets, like it is monitored, assessed and then treated. So it is meeting the HCC criteria. Second comes provider documentation, which means the documented by an acceptable provider like MD, NPPA, etc. Signed signature is very important, as well as it should include face-to-face encounter. Third comes speciality and accuracy of diagnosis, specific to the highest level, accurate and clinically supported by the provider's note, and current for the reporting year. In short, a valid HCC diagnosis must be documented with meet criteria and recorded by a qualified provider. Third comes specific and current for the coding year. In short, if you understand all these things, no, it will be easy for you, because everything like meet criteria, everything only will be repeating again and again. Sixth question, what is meet criteria in HCC coding? Meet stands for monitored, evaluate, assess and treat. It is used to ensure diagnosis is clinically supported and reportable for HCC coding. Here's what each letter means. M means monitor, which means the tracking the condition. Example, symptoms, lab result, medication response or disease progression. BP, checked and recorded. Second comes evaluate, review the test result or the patient's response to the treatment. Example, blood sugar levels are evaluated. Assess, A for assess, documenting the status, severity or stability of the condition. And treat is providing treatment, prescribing medication, ordering test, counseling or referring to a specialist. And in simple term, meet proves that the condition was actively managed during the encounter. And seventh question, give 5 real world meet examples you can use for HCC interview preparation. First example is diabetes mellitus type 2. In this, monitored, like check fasting blood sugar and evaluate, review the lab result and assess diabetes poorly controlled, treatment increased metformin dose to 1000 mg. So in this, all the meet is done. So it is meeting the HCC criteria. Second, hypertension. So here, monitored, the blood pressure measured, evaluated, comparing it to the prior readings, assessment, hypertension uncontrolled and treatment added amlodipine 5 mg daily. So here meet is supported, code is reportable for HCC. Example 3. COPD. So here, monitored shortness of breath, oxygen saturation, evaluation is reviewed, spirometry result, COPD is stable in the assessment and they have continued albuterol inhaler, PRN. So treatment is also done. So meet is supported, code is reportable for the HCC. Example 4 is CKD, chronic kidney disease. Here, monitored creatinine GFR levels, evaluation compared current and previous lab result, kidney function is worsening, that is assessment done and referred to the nephrologist for evaluation. Treatment is also done. So here it is meet is supported, so code is reportable for HCC. Example 5, depression. So here the diagnosis is major depressive disorder. Monitor is screened PHQ-9 score and in evaluation reviewed the medication adherence and side effects. Assessment, depression improved with therapy. Treatment continued, sertraline 50 mg daily. So here meet is supported, code is reportable for HCC. So always mention that for a diagnosis to be captured for HCC, the documentation must meet. Expand meet and explain each term. The term meet stands for 4 essential elements that must be documented by the provider to support and validate a diagnosis for risk adjustment coding. First, M for monitor. This means the provider is tracking and observing the condition. It shows the condition is being followed up or checked regularly. Example, monitoring blood sugar, diabetes check, etc. Second comes evaluation. This means the provider reviews, interprets or assesses test results or symptoms related to the condition. Example, reviewing the lab result, image or vital signs, evaluating response to the treatment. So keyword examples are reviewed labs, reviewed lab results, compared previous reading. Those can be used as a keyword for that. Assess, A for assess. This means the provider makes a conclusion about the condition, its status, progress, or severity. Example: diabetes controlled, hypertension worsening, asthma stable. So these are the conditions, like we can understand, no, conditions improving or deteriorating. Keywords are assessment, impression, stable, uncontrolled, improving, those things. Last T is for treatment. So this means the provider takes action to manage or treat the condition. Example: prescribing or adjusting medication, referring to a specialist, ordering lab or test, giving lifestyle advice. So here the keywords used will be prescribed, referred, ordered, continue medication, adjust dosage, etc. Summary: a diagnosis is valid for HCC coding only if it meets the MEET criteria, meaning the provider has to be monitored, evaluated, assessed, or treated the condition during the encounter. Example: diabetes type 2. So here the documentation support checked HbA1c, reviewed lab result, and diabetes controlled with medication. So everything is done. What is the difference between chronic and acute condition? A chronic condition is a long-term illness that usually develops slowly and lasts for a month or a year. So examples: diabetes mellitus, hypertension, CKD, COPD, heart failure. So here the key point is it should last more than 3 months, managed continuously, often stable but may have fluctuations. Acute condition: an acute condition develops suddenly and lasts for a shorter period, usually days or weeks. Example: acute appendicitis, acute bronchitis, acute MI, acute fracture, pneumonia, etc. Key points: sudden onset, short duration, usually curable, not typical, used for risk adjustment unless it has a chronic complication. So interview tip for this acute and chronic condition: you can say like acute condition is short term and develops suddenly, while a chronic condition lasts for a long term and requires continuous management. Chronic conditions are very important in HCC coding because they affect the patient's long term risk adjustment factor, RAF score. The next question is, why are chronic conditions important in HCC coding? Chronic conditions are very important in HCC coding because they directly affect the RAF score, which determines how much payment a healthcare plan receives for managing a patient's health. Simple explanation: chronic condition lasts long term, like diabetes, hypertension, or COPD. They need ongoing care and treatment, which increase the cost and complexity of the patient's care. Example: if the patient has diabetes HCC 19 or diabetic CKD HCC 18, if both are coded properly, the RAF score increases because the patient is sicker and need more resources. If you miss one diagnosis, it leads to lower payment and underreporting of the patient's health condition. Key points is HCC ensures that the patient chronic conditions are captured every year to reflect this score. 11th question: how often should chronic condition be reported in HCC? In HCC coding, chronic condition must be reported every calendar year, even if the condition hasn't changed. This is because HCC models reset every year, and if a diagnosis is not documented and coded again, it will not count towards the patient's risk adjustment factor. Example: if diabetes E11.9 was coded in 2024 and the patient still has diabetes in 2025, the provider must document and code it again in 2025. Key points: if it is not coded this year, it doesn't exist this year. Every chronic condition must be evaluated, documented, and coded once every year to ensure accurate risk adjustment and reimbursement. 12th question: what is the role of MEET criteria in validating HCC codes? The MEET criteria ensures that every diagnosis coded in HCC is supported by the provider documentation and reflects true clinical management of the patient condition. Without MEET, a diagnosis is not valid for a HCC capture even if it is listed. Purpose of meet: provider proves the diagnosis is active and managed during the visit, helps auditors confirm that the condition is current and clinically relevant, prevent overcoding or unsupported coding. Example: if the provider writes type 2 diabetes controlled, continue metformin 500 mg daily. So here everything is fine, so the diagnosis is meeting the HCC criteria. Invalid example is history of diabetes, so no monitoring, no treatment, no evaluation. This does not meet criteria, so cannot be used for HCC. So here every diagnosis must meet to be valid for HCC coding. It ensures accuracy, compliance and proper reimbursement in the risk adjustment process. 13. Common chronic condition captured in HCC coding. HCC coding mainly focus on chronic and high impact diseases, conditions that require long-term management and increase healthcare costs. These are used to calculate a patient RAF score. Common chronic conditions are cardiovascular condition like hypertension, congestive heart failure, chronic artery disease, endocrine and metabolic disorders like diabetes, hypothyroidism, obesity, hyperlipidemia, respiratory condition like COPD, asthma, pulmonary hypertension, neurological condition like Parkinson's disease, Alzheimer's disease, multiple sclerosis, stroke with residual effect, and so on. Like all the system I have mentioned. So renal kidney disease like CKD stage 1 to 5, end stage renal disease. When coming to cancer and immunological disorder, any malignant neoplasm like active cancer, HIV or AIDS, immune deficiency disorder. When coming to musculoskeletal conditions like rheumatoid arthritis, osteoarthritis, amputation status. And when coming to the mental and behavioral disorder like depression, bipolar, schizophrenia, anxiety, why they matter? Because each of these conditions impact the RAF score, affect the payment model, must be monitored, evaluated, assessed or treated each year. So the key point here is chronic condition must be documented and coded every calendar year, even if it is stable or controlled. 14th question, how often should a chronic condition be reported in HCC coding? In HCC coding, chronic condition must be reported every calendar year, even if the condition hasn't changed or is stable. Reason, the HCC model resets every year. That means the system does not carry forward diagnosis from the previous year automatically. So if example, a patient had diabetes with neuropathy coded in 2024. If the provider doesn't document it in 2025, the diagnosis won't be captured in HCC report. So it is essential to reconfirm and code all chronic conditions annually. Chronic condition must be coded every year if the condition is controlled, stable or unchanged. Key tips for coders: when reviewing the chart for HCC, always look for active chronic problems in the assessment and plan section. Make sure the provided document meet, that is monitor, evaluate, assess and treat for each chronic condition. Avoid coding past history unless it's clearly active and managed. So the next question, 15th question, what is meet documentation and why is it important in HCC coding? Meet is a documentation guideline that shows the provider involvement in managing a condition. Each letter stands for an action the provider must show in the note. So M is for monitor, checking symptoms, ordering labs or follow-up chronic conditions. E is for evaluate, reviewing the test result, medication response or side effect. A is for assess, giving clinical opinion or diagnosis. T is for treatment, prescribing medication, referrals or therapy. So that is a full form for meet. M for monitor, E for evaluate, A for assess and T is for treatment. Simple explanation: for a diagnosis to count for HCC coding, the provider must document at least one meet action in the encounter. If there is no meet, the diagnosis is considered unsupported and cannot be used for the risk adjustment. Incorrect documentation example: diabetes mellitus, known case, no meet shows, can't code for HCC. Correct documentation: diabetes Why meet is important? Ensure accuracy for diagnosis coding. Help coder prove that a condition is actively managed, not historical. Impact the patient's RAF score and reimbursement. Supports audit readiness and compliance. In short, every chronic condition in HCC coding must have meet documentation, otherwise it won't count. 17th, common documentation errors in HCC coding. Proper documentation is a foundation of HCC coding. Even small mistakes can lead to RAF score loss, audit failure, or compliance issue. Below are the most common documentation errors you can find. Missing meet documentation. Diagnoses are listed but no monitor, evaluate, assess, treat documentation found. Second is using history code instead of active diagnosis. Third is lack of specificity. Fourth one is missing link between the condition. That is failing to link related conditions such as diabetes with neuropathy or hypertension with CKD. Sorry, I'm recording during the time of Diwali, so there is sound interruption here. Fifth point is copy, paste or clone notes. Same diagnosis copied across visits without meet updates. Every encounter must show active management or evaluation. Sixth point, not updating chronic condition annually. And seventh point is missing provider signature or credentials. That is very, very important. Ensure all documentation should include the signature. And eighth point is incorrect status coding for cancer or amputation. And ninth point is acute condition reported as chronic or vice versa. And 10th point is missing evidence for suspected or probable conditions. Code only confirm diagnosis for outpatient encounter. Next question, difference between I-63 and I-69 codes in ICD-10. I-63 is for cerebral infarction acute stroke. This code is used when the patient is currently having an active stroke. Example, patient is admitted with acute ischemic stroke due to thrombosis. So the stroke is happening now. So I-69 is sequelae of cerebrovascular disease, that is old stroke or late effect. 19th, difference between TIA and stroke. TIA is transient ischemic attack, also called as mini stroke. It is caused by a temporary blockage in the blood flow to the brain. Symptoms are similar to a stroke but last less than 24 hours. No permanent brain damage occurs. So here the code for that is G45.9. Whereas stroke is I-63 caused by a permanent blockage or rupture of a blood vessel in the brain. It leads to brain tissue death. Symptoms last more than 24 hours and may cause permanent deficits like paralysis or speech problems. So the ICD code will be I-63. So if the symptoms resolve completely within 24 hours, it is TIA, and if it persists or long-lasting damage, it is I-63. So last question, what is the difference between HCC and RxHCC? HCC focuses on medical condition to calculate the RAF score for predicting healthcare cost. RxHCC is prescription HCC, is based on medication usage and reflects the cost of drug therapy used for treating chronic conditions. Example, diabetes, you can just see the example. So thank you so much for watching. I hope this session helped you to understand the key concept and boost your confidence for medical coding interview. If you found this helpful, don't forget to like, share and subscribe. Learn with Danya for more interview focused content. If you are planning for interview guidance training, you can join with me. A complete preparation will be done from us. Thank you so much for watching. All the best. See you in next video.